So today's moderator is Dr. Hui-Yu Tsai. I hope I pronounced the name correctly. It's very difficult, but another name she is called as a Kathy. She is a professor at Institute of Nuclear Engineering and Science, National Tsinghua University, Taiwan. She was Director of Medical Physics and Research Center during 2014 to 2016, and the joint appointment as a research professor from 2016 to 2017. She is member of Education and Training Committee of Afomp since 2019. Education and Training, which is the chair is Jin Xians. Dr. Tsai graduated from the Department of Nuclear Science, National Tsinghua University. She has 18 years of experience in radiation protection in medicine. Her research interest is on development of radiation safety regarding patients and medical staff in diagnostic imaging and radiation therapy. She has been collaborating with clinicians and scientists in radiology and radiotherapy and serving as a PI in more than 20 research grants. Before I give her the floor, let me tell you that in Afomp, we are carrying out a lot of activities, a lot of awards and a lot of programs. If you visit the website, you will find that this year, Professor Mashohari Indo has got the Lifetime Achievement Award. Professor Taisuk is the Professor Kiyonari Inamura Afomp Memorial Orator. Yoshiro Aileo got the Best Publication Award of the Afomp, and Ying Song, the Young Achievers Award, P.N. Krishnamurti Award. And now you can see on the website, Professor Sung Chul Afomp, the Best Publication Award is also on. So a lot of activities we are doing. So please try to participate, try to come into this thing so that you are also part of this Afomp. With these words, I hand over the floor to Kathy for introducing today's speaker of this webinar. Professor Kathy, the floor is yours.
Okay, thank you, Professor Aran. So let me share my screen. So do you see the screen?
Perfect.
Okay, thank you. Ladies and gentlemen, good day. I'm Hui-Yu from National Tsinghua University in Taiwan. And today it's my great pleasure to be the moderator of this section. And our invited speaker today is Professor Arimura. He is the expert of the radiomics and the radiogenomics with AI for oncology. And before we into this field, I would like to use Professor Arimura's paper in Journal of Radiation Research to do a brief introduction of today's topic and let you know the importance of this topic. So about the radiogenomics, because there are a lot of DNA inside our body, so we can get the gene from the DNA, and we can know the gene expression, and we also can observe the cancer trait, and then combine this information. Maybe we can know the genotype and the cancer trait, and then to combine those information to make a prediction of the prognosis to know patient is have a good survival probability or not. And also this is the same thing in the medical imaging, because patient will go to the hospital and make some medical imaging. The medical imaging may be from multiple modalities, such as computed tomography, such as MRI and mammography, computed tomography, sorry. Okay, CT, MRI, and mammography or ultrasound. Those are medical imaging. And those imaging, we can get its imaging features. So we can extract the information from the imaging. So we can extract the histogram like this one, and the texture or the shape of the organ or the wavelet or any other features. And we can call for the AI for to find out which features are most important in the category, and we can select all of the important features, and then we place in the model, in the AI model, and then we can categorize the patient stratification, and then we can combine those information, and we can do the prediction for prognosis. So I can call that the radiogenomics and the radiomics get the information from patient, and then they play very important roles in precision diagnosis and the treatment of oncology. So today, our invited speaker is Professor Hidetaka Arimura. He is a professor of the Division of Medical Content Science of National University Corporation, Kyushu University. And his research interest is focused on medical imaging analysis, computer-assisted radiation therapy, and also the data science. So today I choose to use the numbers to introduce Professor Arimura. He is a very productive author in science. So you can see that his publication is dramatically. You can see in his research life, he published almost 100 articles, and half of 100 conference contribution and conference articles, and also 6 review articles. And I provide this histogram for you. You can see its publication has dramatic increase between 2005 and 2010, and then keep a constant of almost 8 publications per year. So I say he is a very productive author. And his research work get a lot of attention. So there are almost 1,000 citations of his publication, and with the H index of 14. He also a very important role in medical physics. So he hosts the scientific committee in 2020 of the Japan Society of Medical Physics. And in that year, the topic, the main theme of that meeting is the power of imaging. So he also chief editor of this book. We call it Imaging-Based Computed Assisted Radiation Therapy. So I must conclude that Professor Arimura is the perfect person and the most appropriate speaker for today's topic, radiomics and the radiation, radiomics and the radiogenomics with AI for oncology. So let's welcome Professor Arimura.
Thank you very much.
So
okay. What can I share? Oh, sorry.
I have stopped the share screen. Okay. It's your turn.
Thank you. And, okay, thank you very much. Very nice, and your introduction overcome me. Almost overcomes me. So I'm very nervous. So, okay. Anyway, I'd like to start my talk. And hello everyone, and ni hao, annyeonghaseyo, and selamat siang, and namaste, and I don't know other languages, sorry. And thank you very much for giving me a chance to share my talk about the radiomics and the radiogenomics with AI for oncology. And I deeply appreciate to all of committee members, especially Dr. Arun and Cassie, she's moderator, and Dr. Tsai, and in Afomp monthly webinar series. So this is my outline. And at first, what the issue in background of radiomics, and how can radiomics solve these issues? And as a break time, I'd like to introduce Society 5.0 in Japan. And next, I'd like to introduce mathematical models beyond conventional radiomics. And finally, I'd like to summarize the value of radiomics. And what are issues in background of radiomics? And, in general, how are cancer patients treated? Each patient has basically 4 options. So surgery and chemotherapy and radiotherapy, immune therapy, and but more options if they are combined. And the problem is how to decide a treatment approach for each cancer patient. So here is an example of how to decide each treatment approach for non-small cell lung cancer patients. If a patient is operable with stage 1A tumor, this patient will receive surgery. But if not, the patient is inoperable, this patient could receive radiation therapy. However, we have an issue. Patients with similar profiles treated by radiation therapy may have different survival times. There are 2 CT images of lung cancer patients who received radiation therapy. They seem to have different appearance, but they have same histology, squamous cell carcinoma, and but similar ages. And in fact, the 2 patients had quite different survival times. Around 4 years for the left patient and less than 1 year for the right patient. So the issue is one-size-fits-all treatment procedures could be unsuitable for some patients. So issues are related to biopsy. So first issue is some patient may refuse the invasive needle biopsy due to concerns about the pneumothorax, around 30 to 40% refusing rate. And the second issue is liquid biopsy has not shown high sensitivity yet. And a single biopsy of a heterogeneous tumor could lead to or overestimation of omics information. So here is the example. There are many types of gene mutation in the same kidney cancer in the different location. And when it comes to the invasive biopsy, how can you perform precision medicine if the issue are not sampled by the biopsy? Precision medicine is a form of medicine that uses information about the person's own genes or proteins to prevent diagnostic or treatment disease. And patient with tumors that share a same drug, same genetic mutation can receive same drug that targets the mutation, no matter the cancer type. So in this case, we are just focusing on gene mutations, but we don't care where the cancer is. But if the gene mutation is not obtained, the appropriate drugs cannot be decided. That's a problem. So how can Radiomics solve these issues? And so as for a detrimental impacts of invasive biopsy on patients, Radiomics solution is non-invasive biopsy, non-invasive imaging biopsy. So here is an example. We'd like to change, I'd like to replace invasive needle biopsy by non-invasive imaging biopsy based on Radiomics. And regarding misleading estimation of a single biopsy of heterogeneous tumors, Radiomics solution is entire image information from a tumor in medical images. And about unsuitable or one-size-fits-all treatment procedure to some patients, Radiomics solution is stratification of patients into effective and ineffective patients by predicting their prognosis. And what do I assume in Radiomics? So since the Radiomics could be terminals, since the medical images could be terminals of cascade from our genes, the images may include gene or protein or metabolic information. So this omics information is considered as including prognostic information. And thus, these medical images may also include this information. So there are something omics such as genomics and proteomics and radiomics and radiogenomics, radioproteomics and radiogenomics and metabolomics, which are associated with medical physics field. And if the Radiomics can decompose tumor image into micro or nano order levels, Radiomics models may extract micro or nano order information from medical images. This is a basic assumption of imaging biopsy. So therefore, I think Radiomics can assist physicians to perform precision medicine by linking between image signatures and treatment approaches. We can select an optimum treatment approach. Furthermore, by the way, signature is a set of significant features selected by some method. And furthermore, by linking between image features and gene mutations associated with cancer, we can use same molecular targeted drug for the patient with corresponding to gene mutations. So this is the idea of Radiomics or radiogenomics. And here is a typical workflow of Radiomics with AI. At first, correction of pre-treatment images with target prognosis that you want to predict. The target prognosis are high risk recurrence or normal tissue toxicity, etc. And second is feature extraction by using many mathematical models. And next, building of a signature to select significant features. And fourth, patient stratification using simple models or machine learning, that is the AI. And finally, evaluation using ROC analysis or suburban analysis like Kaplan-Meier curve and so on. And I'd like to introduce several researches that solve the issue that I mentioned. This research was to investigate a prediction model of 2-year survival, 2-year overall survival for non-small cell lung cancer stage 1 to 3B. And by using this proposed method, you can select one of optimum treatment method, radiation therapy or surgery. And this research was to develop prediction model for responder and non-responder to neoadjuvant chemotherapy for nasopharyngeal carcinoma. And you can select effective patient to the neoadjuvant chemotherapy. And this study that we proposed, developed, and predictive model for radiation pneumonitis, which is one of the normal tissue toxicity in radiation therapy, using planning CT prior to stereotactic body radiation therapy. And we showed best performance to classify SBRT patients into radiation pneumonitis patients with more than more than grade 2 toxicity and a low grade patient. By using this method, we can classify, we can carefully determine the dose distribution of lung lesion during treatment planning for the patients who are likely to happen. And there are many radiogenomics researches for identification of patients with EGFR mutation using CT or MRs. I picked up 4 studies which showed AUC of around 0.8 to 0.88 in this test. And 2 studies investigate the differentiation models of EGFR mutation subtypes, 19-DELF and L858R using CT, and exon 19 and 21 by using MR. And this study developed a deep learning approach which showed a relatively higher AUC of around 0.8 in a test. Okay, I'd like to take a break, just a moment. So I'd like to take a break just for minutes to explain Society 5.0. So 5.0, Society 5.0 project has been proposed by Japanese government in 2016 in the world. Now we are moving toward Society 5.0 beyond Society 4.0, which is the current world. And what is Society 1.0 to 4.0? So for Society 1.0 is a hunter-gatherer society, like a Stone Age. And Society 2.0 is an agrarian society, like the agricultural era. And Society 3.0 is an industrial society after Industrial Revolution. And the Society 4.0 is a current world, which is information society after the information revolution. And what is Society 5.0? So now Society 4.0, human in physical space should do everything using physical or cyberspaces. On the other hand, in the future, in Society 5.0, a society that AI will help humans do many things to achieve better human life by solving that the AI, by solving social issue by using AI. And the method is AI corrects, sense the big data and solves various social issues. And here are examples of how Society 5.0 will change the healthcare field. This senior person, a relatively senior person, is thinking about, I want to know my futures about my body condition before symptoms will happen. And also, I want to live by myself with independence and joyfulness. And the solutions in Society 5.0 are AI-based management of all medical information and real-time monitoring physiological big data, including body temperature, blood pressure, heart rate, etc., by using Internet of Things. And analysis of the collected data, including medical images, using AI to predict individual physical conditions and/or prognosis. Okay, I'd like to explain the mathematical models beyond conventional radiomics. There are disadvantages in conventional radiomics and the deep learning. The disadvantage of conventional radiomics features are interscanner variability and vulnerability for various imaging protocols. And the disadvantage of deep learning is that we need huge amount of data. So we need something invariant, that is the truth, which could be robust and work well in small training data sets. In Zen Buddhism, moon is invariant because even water stream cannot move the moon on the river. So we consider mathematics as a moon. So what are requirements of better features in radiomics from medical point of view? Here are hallmarks of cancer phenotypes such as induction of angiogenesis and genome instability. Image feature should reflect one or some of the cancer formats. And the image feature should be associated with prognosis of cancer. And furthermore, we have another requirement. What are requirements of better features in Radiomics from AI pattern recognition point of view? First, features should be similar to those for objects in same categories. But they should be different from those for objects in different categories. So features, and second, features should be invariant to irrelevant transformation of input, such as translation, rotation, and scale. So here are examples. If an image cancer, original cancer image produces a feature of F, the translated and rotated images should output the same feature value of F. And downsampled or upsampled images should produce feature value of F. And topology I introduced is one of the theory that we want. Topology deals with just the connectivity. In topology, an agent T cup here is equivalent to sphere. But a coffee cup, like a mug cup, is equivalent to donut, a donut. And further, Asian teapot may be equivalent to double donut. So therefore, topological person can eat a coffee cup with trying to drinking coffee from donut. So this person cannot differentiate a coffee cup and a donut. This is a topological idea. And what is a topology? So topology is soft geometry and a geometry of connectivity, and considering only the number of connected components and the four which do not depend on concrete shape. Batch numbers B0 and B1 are defined by the number of connected components, 0-dimensional 4, and the number of closed region, 1-dimensional 4. And B1 can be computed by using this simple equation, using the number of vertices and edges. And here are example. So bottom left graph shows one connected component and 3 vertices and edges. So therefore, B0 is equal to 1, and B1 is 1. And in this case, there are 2 connected components, and 8, I think, 8 vertices and 9 edges. So in this case, B0 is equal to 2, and B1 is equal to 3. So that's a simple calculation. And homology can be calculated by Python program in Google Cloud I use. And this is the equation, a little bit complicated equation, homology theory. So here are Python program and the installation method that I use for calculation of batch numbers in the previous slide. And here is one of the homology groups. that is persistent homology, and which is a famous topological data analysis. This study used persistent homology for hepatic tumor classification. And persistent homology can track the emergence, birth threshold value, and disappearance that the threshold value of topological features, including connected components and folds by using multiple thresholding technique. These graphs show the relationship between the birth and dead threshold values for connected components or folds. It is called persistent diagram. In the calculation, in the classification of hepatocellular carcinoma, HCC, and metastatic tumor, MT, the accuracy of 92% by texture analysis was higher than the highest accuracy of 85% by persistent homology. And this study shows the lung topology characteristics by persistent homology. And persistent homology can stratify patients into chronic obstructive pulmonary disease, COPD, and healthy people. And this study applied homology theory to prediction of prognosis of lung cancer. These images shows many folds which can be quantitated by batch number 1. And they show that the usefulness of homology features in prediction of features patient's prognosis compared with standard radiomic features. And we also employ the homology features, which were different calculation from the hardware senses study in the previous study. By the way, why can we use homology or topology for prognostic prediction in lung cancer patients? Because cavitations or folds may have prognostic power of lung cancer patients according to these two studies. The Kaplan-Meier analysis in the right hand shows a significant difference between overall survival rates with and without cavitation in tumor region. So in our study, we selected two invariant features, B0 and B0 for connected components, and B1 for the folds. And there are two different cancer patterns, A and B, but after continuous deformation while keeping invariant features, they are topologically the same batch numbers in the end. So B01 is equal to 1 and the B1 is 1. So topologically invariant number might be able to extract it as intrinsic heterogeneous patterns with patient prognosis without considering concrete shapes like this. And this figure shows a computational process of batch number maps to characterize lung tumor. The upper image shows the batch number 0 map, and the bottom image shows the batch number 1 map. And as a result, there are a significant difference between low and high risk group in terms of our survival probability in the model with topological invariant features. But deep learning did not show significant difference in the test due to the overfitting problem, I think. So as a result, topological invariant features, like batch number 0 and batch number 1 showed much better stratification power than deep learning. And we applied the Radiomics based on the topologically invariant batch numbers to the recognition of TKI sensitizing EGFR mutations in non-small cell lung cancer patients. Because we have specific problem in Asian people about the EGFR mutations, around half of non-small cell lung cancer patients in Asia people may have EGFR mutation compared with Caucasian people like this. And as a result, batch number showed the higher accuracy and the better robustness than conventional features. And because the accuracy of batch number in the test was higher than that of conventional radiomic features. And compared with the past studies, our method achieves the highest AUC, but a little lower robustness than one's studies. And furthermore, I'd like to introduce another invariant features. That is a Hessian index, which is mathematically related to batch number. And this is a differential topology field. And the Hessian index is defined as the number of negative eigenvalues of Hessian matrix. And the Hessian, eigenvalues correspond coefficients of local approximated quadratic function. And the Hessian index can evaluate the local pixel value fluctuation like concave and saddle and a convex region. The index of 0 means concave points, and 1 or 2 index points means saddle points, and 3 means convex point. Therefore, we assumed that the Hessian index can characterize tumor heterogeneity. And we applied the Hessian index features for prediction of patient prognosis in head and neck cancer, which is 6 leading cancer worldwide, and shows still low 5-year survival probability of 50%. And in this study, we obtained index images using various standard deviation of second differential Gaussian function, which may show the tumor heterogeneity. And consequently, the Hessian index features and clinical variable show the highest prognostic power compared with conventional features. And finally, I'd like to highlight the value of Radiomics with AI. And first, stratification of cancer patients into the subtype by using an imaging biopsy, which could mathematically characterize the heterogeneity of tumors in medical images. and could be associated with patient prognosis, and providing us the chances to choose more appropriate treatment approaches prior to patient treatment based on non-invasive pre-treatment images, and assisting physicians to expedite precision medicine in the oncology field. And thank you so much for your listening my talk. 셰이셰이 and 커픈크라 terima kasih 감사합니다. 아리가또 고자이마시타. Thank you very much.
Thank you, Professor Arimura. So right now I collected several questions for you from the audience.
Okay.
Okay. So I will share my screen here.
This one.
Okay.
First he has to.
Or
yeah. Now okay. Now,
Hey, now
okay.
you can share.
Okay. Wait a minute. Can you see the question? There are 4 in this slide.
Yeah, we do.
Yes.
Yeah. Okay. So the first one, Dr. Bates, he asked, is the radiomics useful in differentiating radiation-induced tissue changes from the actual tumor and the recurrence during the course of radiation treatment, or how to deal with it?
Yeah, I think that you can differentiate radiation-induced tissue changes. But I'm not sure how to differentiate. I think there are 2 methods, and one is skin image by using a digital camera on a smartphone, and or you can use CT or MR images. But during the course of radiation treatment, so I think you can use both color skin image or CT or MR, right? What do you think, Dr. RK? Yes.
Okay, so I invited Dr. RK to use the microphone to conversate with the Professor Arimura. Is that okay?
No, it will create a problem. So just you can.
Oh.
Because
okay.
Difficult. Yeah, there will be noise. And
Okay.
So maybe we can discuss later. So
okay.
The second question is, the imaging noise is a dominant factor to influence the result. I mean, the imaging features may affect the pattern, maybe.
Yeah, I think so. I think so. That's why we applied the noise reduction filter, such as Laplacian Gaussian filter, not normal filter, but it's depends on medical images. I think for CT images, we Laplacian Gaussian filter may be effective to reducing noise, and yes, so you have to carefully use noise reduction filter, I think.
Okay, thank you. So I let another question first. Wait, I cannot control my screen. Sorry. Oh, here.
Yeah.
So, I mean, Housing asked, which type of imaging modality provides more prefers for radiomics studies? No, for radiomics study, yeah.
More information. I think more info.
Okay.
Information. It must be information.
Okay. For radiomics study, yeah, it's a very good question. So I don't know which modality is best. So I think so far, in my laboratory, we try to use many imaging modality for the cancer. For example, for lung cancer, we use CT, not only CT images, but PET images. And if the patient have MR, we will use. So we have to use as many medical images as much as possible. I think so.
So you mean different modality, the imaging from different modality by the different information?
Yes. And
okay.
select the best
and select the appropriate one. Okay.
Yes.
Yeah. Okay.
I think that's the best way.
So we need a lot of imaging.
Yeah.
So another question I did not place in the slides. I just read the question. Which type of biomarkers you prefer for radiomics studies?
Which biomarker?
Yeah.
Biomarker obtained from which modality? I don't know.
Okay.
For example, it's UV from PET or ADC map from MR.
Okay.
So we have many types of biomarker, right?
Yeah. Okay, so there is another question in the chat room. Do you have any suggestion? Oh, sorry. Okay, I'm sorry, I lost the question. I cannot handle it.
Okay, just I can ask, is there any possibility of developing mutations in junk DNA or dark DNA?
Junk, sorry.
Is there any possibility of developing mutations in junk DNA or dark DNA?
Dark DNA. Sorry, I don't know junk DNA and dark DNA.
Okay.
What are junk DNA and dark DNA?
Okay. So the next question is, what are the expected pitfalls in radiomics study? Are there any pitfall, a false negative, false positive, or kind of things?
Yes, we have. Of course, we have false positive and false negative in radiomics, like computer-aided diagnosis.
Question? Yeah, there are some more questions.
Okay. Okay, I choose the last one. Okay. So, do you have any suggestion on the software that we can use to perform radiomics analysis for a beginner?
Yeah, I think recently many people use Radiomics library. That's not software, but Radiomics library for Python users. So you can download Radiomics and you can use, I think, as they are. And you can incorporate Radiomics library into your own program. Yes.
Okay. Yeah. So for the beginner,
MATLAB program. Yes.
Okay. So a beginner can start with the Python and know the library in the Python. Yeah. Okay. Okay, finally, I would like to thank the Professor Arimura for the wonderful speech, and we learned a lot from him. So thank you.
Thank you very much. Thank you. Thank you.
And I returned the host to Professor Aran.
Yeah, thank you, Kathy, for conducting this webinar very nicely and very effectively. Thanks to Hidetaka Arimura for an excellent talk on the radiomics and radiogenomics with AI for oncology, which is a buzzword now, AI, and a lot of people want to enter into this field and they want to work and a lot of consortium working on these areas. Dear participant, thanks to you also, because without your participation, the webinar cannot happen. So this is the 16th webinar we had, and we are continuously academic activities doing under the Afomp banner. Thanks to our dynamic chair ETC Jin Xians, the PRC chair Tsai Hong, and Rajini Verma, who is the webmaster with Afomp, and our all Afomp XCOM for helping us to conduct the academic activities. This webinar is a CPD accredited, and a certificate and 2 points will be entitled. The link is given by Jin Xians. So you have to register on that thing. You will get the certificate through the email. Now, as we have started Afomp School webinars since June 2021. And in this series, the webinar 4th will be the evolution of medical physics. And this will be on 18th September 2021, Saturday, from 6:30 a.m. GMT to 9:30 a.m. GMT. You can check your corresponding time. Moderated by Professor Jin Xians, who is again our dynamic chair of the Education and Training Committee. And Kathy is a member of that committee also. And there will be 4 talks, 3 talks actually. The history of radiotherapy physics by Professor Hu, then development of radiotherapy technology by Lee, and modern radiotherapy technology and machines by Jin, and then question answers, they will be there. The link will be available. You can register and you can participate into this thing. And these are the renowned speakers who will be talking in that Afomp School webinar. The 7th October, we have got the Afomp monthly webinar. That's the 17th Afomp monthly webinar, and that will be delivered by Dr. Tai-Suk Su on image guided applications in radiation therapy. And the moderator will be Michael Lee from Hong Kong. Tai-Suk is the immediate past president of the Afomp from Korea. And then we have 11th and 12th, the November and December webinars also are planned. The 21st Asia Oceania Congress of Medical Physics Science for Radiation Medicine is now in hybrid mode. That is in person, face to face, who can travel to Bangladesh. People are eager. The Bangladesh Medical Physics Society is eager to host you. And if you cannot attend face to face in person, you can join virtually. And the abstract submission deadline is extended to 20th September. So this conference is doing 10 to 12th December 2021, Cox's Bazar, Bangladesh. So please do visit the website of this conference and submit your abstract and plan your things. If you can attend in person, you will welcome. If not, even virtually you can do. 2022 conference of AOCMP, that's the 22nd AOCMP, will be in Taipei. Kathy will be the host for all of us in 2022. As I told you that we have started many awards and many things, everyone. So senior category, we have done what is called as a Lifetime Achievement Award.
Hello.
oration. Are you able to listen? Yeah. So everything is there. Also the new award in last 2 year we have added, and another one is Professor Sung Chu, Afomp the medical physics student, either master's or PhD best publication award is there. PhD best PhD PhD award is there. Best publication award is there. So a lot of activities we are doing. So please do visit the Afomp website. Your queries, your feedback will help us to make the terms more useful and more relevant. So please do write to us. With this word, I once again thank Kathy for excellently moderating this webinar, Professor Hidetaka Arimura for a very, very nice talk on a very new and interesting topic, Rajini Verma for coordinating all these activities, Tsai Hong for certification, other making things, and she's a PRC chair, and Jin Xians as an ETC chair, and all Afomp XCOM. And thanks to all the participants, more than 120 participants, they participated in these things. And if you sent the mail or the endorsement link is already there, you can click on that thing, give your data, you will get the PRC Tsai Hong will send you the certificate. With this thing, thank you each one of you for making this monthly Afomp webinar successful. The recording will be available within 1 or 2 days on the Afomp website. So if any one of them missed it, they can see, or they can again listen to these things. So thanking you, stay safe. We are going to meet on 18th of September for our Afomp School webinar. Till then, bye-bye. Have a nice time. Thank you very much.